name is Byron, and I'm here with Al. Al is my friend, and about a year ago he became my boss as well. And we are excited that you are here today as we talk about a few of the changes coming up with Medicare, as well as just some basics, an overview of some of the Medicare basics. Al brings a lot of knowledge to the subject. He's been doing this for a long time. And this educational webinar, I want to emphasize that's all it is. We're not trying to sell you anything. The educational webinar is designed to share that information with you. Knowledge is good. And that reminds me, Al, did you know that recent studies have shown that humans eat more bananas than monkeys?
Well, that makes sense to me. I've never had a monkey. So, anyhow.
Me either.
Yeah.
Makes sense. Okay, good. Well, at any rate, we're going to begin by going over some of the basics of Medicare for us banana-eating people here, I guess. And so, Al, before we do, take a moment and tell us just a little bit about yourself for anybody out there maybe watching who doesn't really know you.
So, Al Schiebel. I've been married 36 years, and I've been in the business for 25 years in the insurance business. Our office is in Sandy Springs. Really love helping people and providing education.
Good, good. And who works with you besides me?
This guy, and then some of you have, a lot of you have talked to Dale, and Dale is the backbone of the operations. You know, she's the lady that answers the phone, and she's the one that is pestering you to get drug plan information and all that stuff. But anyhow, she's a sweetheart, and she's handling the phones right now.
Right now. And as you can imagine, Dale also plays the important role of trying to keep two goofballs in line here. And she's invaluable, and she calls you honey when you call, and we all love that about her. All right, Al, let's get right to it. Take a little time and go over some of the very basics of Medicare. Let's start with the parts of Medicare to remind everybody, what are those parts of Medicare? And by the way, Kathleen says, go Tigers, G-E-A-U-X. All right. What are those parts of Medicare, and what do they cover?
But before I get started with that,
okay.
I want to reiterate that this is by any means a marketing type of webinar. It's just mainly a way to refresh our clients' memories about Medicare and Medicare program. I cannot mention company plan. I cannot mention companies or anything like that. If you have any questions, give us a call, and I'll be happy to talk to them.
But not just refresh. We are going to talk about a few new changes.
Yes, we're going to be talking about a few things. So Medicare's made out of pieces parts. And one good, like I had to remember about Medicare is parts have you have part A and B, and plans, and they're talking about Medicare supplements.
Right.
But talking about Medicare Part A. Part A covers hospitals, and before that, Medicare covers individuals who are turning 65.
Right.
Or they're under 65 and they have some kind of form of disability as deemed by Social Security.
Right.
Also, if they have an end-stage renal disease. Mm-hmm. So again, Part A covers hospitals, and there's no premium for Part A.
Right.
Okay.
Doesn't mean it's free, but they pay.
It's not free. They paid for it all their lives.
Right. Right.
And then Part B covers doctors, and Part B has a premium. Okay. And it starts at $148.50 in 2021. Okay.
We don't have the number for 2022 yet.
Wait, that's coming. So
That's coming.
anyhow, but and then you have a Part B that you have Part A and Part B have deductibles, and we can get into those details if you give me a call. The other thing is that Part A and Part B is considered is also known as Original Medicare.
Right.
And then there's Part C. Part C is Medicare Advantage.
Yep.
And Medicare Advantage plans replace A and B. That does not mean that you have to cancel A and B. You cannot have Medicare Advantage without having A and B in place. And then there's the Part D, which is drug plans.
Right.
Okay.
D is for drugs.
D is for drugs.
There you go.
So, yeah.
We had a friend who may or may not be able to join us today. We've had some technical issues, and he had a question. Let me say real quickly, because it's right on this subject. He was talking about the fact that he knows that Part A covers hospitalization, and he was looking at his plan. It talks about the details, specifics of that. And his question is, does Medicare Advantage cover hospitalization? Is anything paid out of Medicare Part A? You got that question?
So with the Medicare Advantage plan, they take over what Part A and Part B.
Right.
Okay.
Right.
Medicare A and B are always in the background regulating these insurance companies.
Right.
So Medicare Advantage is provided by private insurance companies, and so they're regulating things. Now, in some cases, Part A may be involved directly in Medicare, but for the most part, the plan that is adjudicating and filing all the claims is a Medicare Advantage.
Okay. All right. Good. Well, talk a little bit about Medicare enrollment. That's pretty important. Tis the season. How does that work, Al?
So, you probably are starting to see a lot of ads on TV. Okay. And how many Joes are they going to find?
3 Joes.
3 Joes.
Now
okay?
pumping Medicare
Yes.
Advantage.
And then there's Dynamite.
Jimmy.
Yeah,
There you go. 3 old quarterbacks and an old actor.
You know why is that? Is because annual open enrollment starts tomorrow, October 15th, and then goes until December 7th. And this is a time of the year that you can make changes to either a Medicare Advantage plan or a Medicare Medicare drug plan.
Right.
Okay. Now, Medicare supplements don't have an open enrollment period every year per se.
Okay.
You have an initial guaranteed issue open enrollment, and then if you want to change from plan to plan, you have to go through medical underwriting. Right. But call me if you have questions about that, if you have a Medicare supplement.
Sure. Eligibility is an important issue to mention, Al. Who is eligible to be enrolled in Medicaid? You kind of covered that already.
Yeah.
Anything else you want to say about that?
You got to be 65.
Right.
Also, you got to be either disabled and deemed disabled by Social Security.
Right.
And then you can enroll in Medicare.
Okay,
So, yeah.
got that already then.
Yeah.
What about the costs of Medicare? Walk us through a little bit on how the costs play into this whole thing, because obviously we're all looking at the bottom line on this kind of thing, right?
That's right. So Medicare, talking about costs, you have premiums,
right,
and then also costs to receive service. You have 2 different categories. The premiums are what you pay to get the plan.
Right.
And as I mentioned, Part A doesn't have a premium. Not free.
Not free.
You've been working into the system. You have to work at least 10 years in order to get Medicare Part A without a premium.
Right.
They call it free A. If you work less than 10 years or 40 quarters.
40 quarters, right.
Okay. Then you will have to pay a premium.
Right.
And usually these are hefty premiums too. So
Yeah.
now Part B has a premium, and it's $148.50. And here's one thing that I've seen for 2022.
Okay.
Not official, but I've heard that Part B is going up to $158.50. $158.50.
When are you going to know that for sure? That's tomorrow?
No. They usually announce that in December, and they will be all over the news, or you'll get something. But that's what I'm hearing. Not official, please.
Right.
Don't quote me on that. Right. Yeah. And then the other cost to deal with is, Medicare Advantage plans. A lot of plans have 0 premium. There's some plans that have a premium included.
Right.
Okay. And then if you have a Medicare supplement and a drug plan, a supplement will always have a premium, and then a drug plan will always have a premium.
Okay.
So,
okay.
yeah.
Hopefully that's clear. If you have questions, of course, as always, feel free to call and ask.
On Zoom only gives us 30 minutes, so we're just trying to, move it along. So
That's right.
thank you.
Is there a website folks can go to get the information they need, Al?
Well, I'm glad you
I'm
asked.
glad I asked too.
It's a shameless plug on us. So it's alknowsmedicare.com. alknowsmedicare.com. And if you don't find information, send us a contact. Just fill the form and tell us what is it that you want, or give us a call at 404-256-2171.
And there is an official government website as well.
Medicare.gov.
Yeah.
The good news about Medicare.gov is that it's chock full of information. But if you don't know what you're asking, it can lead to a lot of confusion.
Right. So we're here producing our own website. We're going to announce this to you right now. We've written an ebook. Okay.
Yes.
Wasn't going to say that, but I'm going to say it now. And it's a little more information, and we call it Medicare Basics with Jokes. It'll be coming out soon. watch for that. All right, let's get into the first change, Al.
Now, let me tell you about a little bit about jokes. Is that we have a weekly feature called Al Corney's
Corny joke of the week every Wednesday,
and on LinkedIn, and we love for you to subscribe to that
and Facebook.
Right. And also we have a YouTube channel.
Yeah,
Al Knows Al Knows Insurance.
That's right.
And the funny thing is that we don't take this lightly, but you know what? Life is so full of stress that we just like to have fun. Okay, and so hopefully this does not insult you, but we just like to have fun.
That's right.
And when it's dealing with your Medicare and everything, I'm going to be very serious, and I'm going to take that matter serious. But you know what? Just gotta have fun.
Medicare.gov, 0 jokes, none.
So,
all right, let's get
great information though.
Great information. Let's talk about the first change.
By the way, the government made me say that.
The government got a gun to your head. COVID-19 obviously has changed so much in our society, and my question is, what is Medicare doing specifically with regard to COVID, Al?
So these are new things, among the new things that we are discovering on Medicare, about Medicare. So not new things, but just an extension. Of course, COVID is crazy. The thing about, biggest thing is vaccines, I'm pro-vaccines from the standpoint that it's got to be your choice, and
Sure.
This conversation with you and your doctor, and if that makes sense, please do not ignore the conversation with your doctor.
Right.
But right now, as of right now, you pay nothing for the vaccines, and they're going to continue doing that. And the important thing that I've read is that right now we have a public health emergency that's concerned because of COVID-19.
Sure.
If they remove that, those free costs for vaccines may go away. So it's possible for that. I'm not 100% clear, but just always trust, but verify.
Right.
Call your doctor, call the healthcare plan. But as of today, I can tell you the vaccines are covered. The other thing is diagnostic tests. Okay. And while we're still in the public health emergency, the FDA authorized tests for COVID-19 are covered, and you pay nothing for this test.
Okay. Yeah.
The other thing that I get asked you, the question is antibody tests, and these are FDA authorized tests to help you see if you have developed some kind of immune response. Mm-hmm. At this point, again, you don't pay nothing, while the public health emergency is going.
Right.
And lastly is this is a big word. I went to school at LSU, so forgive me. But monoclonal antibody treatments. And these are treatments that help fight the disease and help you keep out of the hospital. And it says if you test positive for COVID-19 and have mild to moderate symptoms, but also you pay nothing for this treatment during the COVID-19 emergency, public health emergency. If you notice, the theme is public health emergency.
Right.
And always check with a provider.
Oh, sure.
Always check with the insurance company to make sure that, just don't assume. So anyhow.
Sure. Well, this is our first ever webinar. We have our first ever question. We're going to take a quick break and answer it. Our new friend Tom said, this is my second year with you. What do I need to do to keep the plan I'm currently on? Just asking for general information. Great question, Tom. Al?
So if you have an existing plan, if you have so with Tom's question is second year. What we do for our clients is that we review everybody's drug list and we make sure that the plan is most appropriate for them for the next year.
Right.
And so we're either going to give you a call or going to send you an email saying the call is going to be, we need to change. Okay. If we send you an email, it's going to be, stay where you are, because we have reviewed all the plans and stuff.
Right.
Of course, if you have questions, always call us, and that sort of thing. So just remember, annual open enrollment is October 15th through December 7th.
Yeah.
That's the time that we need to talk.
And if you keep your same plan, you need to do exactly nothing.
Exactly nothing.
It'll roll over for you automatically. All right.
But we're reviewing that.
Oh, sure.
And just keep in mind, and I ask you that you be patient with us, is that we have nearly 500 clients.
Right.
With a lot more people that are calling us, and we're really trying to get to everybody.
Sure.
You know, but it's kind of like, you know, if you've been in Atlanta, 285, trying to get from 400 southbound to 285 west, it goes to one lane.
Major
So
headache.
just keep that in mind. That kind of may be a little bit back up. Please be patient.
That's exactly right. We got two more areas, particularly of new things. Let's get right back into those. Issues regarding cognitive impairment are pretty critical for folks as they age. We know the devastating effects of various types of dementia, Alzheimer's, things like that, and the importance of establishing a care plan for patients who are dealing with these things. Tell us more about something that's maybe changed with Medicare for 2022, Al.
So, you know, when you see a doctor for your annual wellness visit,
Right.
yeah,
Right.
he or she may ask you about, you know, mental health issues. You know, do you feel depressed? They might you checking for early signs of dementia and possibly Alzheimer's.
Right.
You know, signs of cognitive impairment. But what has happened is Medicare is going to cover a separate visit with your regular doctor or specialist to do a full review of your cognitive function, and that's new this coming year. And it's going to help you establish a diagnosis of dementia or Alzheimer's disease and develop a care plan.
Care plan. Right. Right.
Yeah, one thing that is important too is that they will allow a loved one to come with you to that visit, and so that's something that is really good.
The government showing compassion. Wow. Excluding skin cancers, colorectal cancer is the third most diagnosed cancer in our country. And it's the second leading cause of cancer deaths each year. Something has changed a little bit in this regard with Medicare for 2022. Tell us about it, Al.
So Medicare covers this lab test in certain cases, if available, but once every 3 years. But you have to be eligible, and you must meet these conditions. You got to be between 50 and 85. Show no symptoms of colorectal disease,
Okay.
but also that you're at an average risk of colorectal disease. And so you pay nothing for the test. If your doctor, any other care providers, they accept Medicare assignment.
Okay. All right. Good.
So,
Good. Really, there's not a great deal of changes in Medicare, but there are three that Medicare.gov cite, and their yearly booklet they put out, Medicare and You, have noted, and we wanted to particularly talk about those three. Now, Al, I do have one quick question. Is there any coverage for people who drink invisible ink?
Not that I'm aware of.
Yeah, well, I'm asking because I have a friend who did that, and right now he's at the hospital waiting to be seen.
Okay, well, thank you. That reminds me of my friend that was kidnapped by mimes,
Yes.
and they did unspeakable things to him.
Unspeakable. Let's move back
anyhow.
to something serious here.
But one thing that I wanted to say, besides the three things that we talked about, keep an eye on some things. Like, for example, I mentioned Part B premium maybe going up, and again, I'm hearing $158.50, not official. So don't call your congressman and say, "Hey, Al Schiebel said it was going to go to $158.50." Also, the Part B deductible. Part B deductible, for those who have a Medicare supplement, you have a $203 deductible today, and it is estimated to be going up to $217 for next year.
Okay. That's not official either.
That is not official. You know,
right.
not until you hear from the government. But that's what I'm reading, and so you get breaking news on this one. Now, if you have a Medicare Advantage or a drug plan, you should have received what is called the annual notice of change.
Okay.
Okay.
Right.
Also lovingly known as ANOC in my industry. And an ANOC, what it does is that it informs you of any changes that you plan might have for the following year. And so it compares the current plan versus the projected plan for 2022, and it tells you specifically all the differences on that.
Okay.
So if you should have, some carriers wait until September 30th. I know that we're on the 14th of October now, but if you have not received it, call the number in the back of your card and say, "I need my annual notice of change." Excuse me. The other thing that I need to tell you is is a donut hole. If those of you who take medications and they're expensive medications, the donut hole thresholds have been changed and have been adjusted a little bit. So I don't want to get into a lot of the weeds because it requires a lot of explanation.
Yeah, sure.
But just know that. And lastly, is that if your income, the IRMA limits, IRMA stands for Income Related Monthly Adjusted Amount, and that is that you would pay extra for your Part B or your Part D, and the income limits that were raised. If you filed singly, is $92,000. If you filed jointly, is $182,000.
Okay.
But they're going to look at your income from 2 years before.
Okay.
So in 2022, they're going to look at was your income in 2020 either if you filed singly $92,000 or $182,000.
Okay.
If you made more than that, you pay more. So
Okay.
anyhow.
Okay. So Irma is more than just one of your old flames. Never mind, let's not go there. We have a question.
No, I don't.
Can we take that question live, or do you want to answer that one offline? Because it does deal with a specific carrier.
Yeah. Kathleen, if you send me a email, go to the website and just do that, because I don't think I have your information. Anyhow, but
we're going to take this one offline.
Yeah.
But we will answer this question. It's a good question, but because it deals with specific carriers,
Yeah.
we're trying to stay general.
But I'll do general. So
Okay, good.
If you have a supplemental plan,
Yeah.
okay, with sorry, I mentioned the name. So erase that. If you have a supplemental plan,
Somebody.
and there's a certain hospital network that is in Cobb County. If you have a supplement, okay, I get a lot of calls about this. If there's a dispute between that hospital and the insurance company, the supplement, it will not affect your supplement or what it pays, because with a supplement, Medicare is primary, and then the supplement is secondary. Okay. Now, the contract negotiations between this large hospital system in Atlanta and another carrier, and a carrier is mainly dealing with plans that have a network of doctors. Okay, and so the network of doctors is negotiating with this plan, and so. But I've been in meetings with this particular large carrier. Sorry, I mentioned that, but this carrier, and they're at the table. They're negotiating. So don't lose faith on that. But it does not affect your that. Go ahead. I'm sorry.
We're getting close to running out of time, Al.
We are.
Any questions, I want to make sure you have time to ask those, and if we get a chance to answer those, we certainly will. Thanks for sharing your knowledge with us, Al, about Medicare, not only the general, but also the changes coming up. Folks can go to their insurance companies directly. You can go to an insurance carrier directly and get Medicare coverage. So what I want to ask is, why come to you?
Thank you for asking, Byron.
Well, it's my pleasure.
It was not in the script. Anyhow, but a lot of my clients like to deal with me is because, number one, they can see me, they can come to my office, we are accessible. You see, we talked about the Three Joes and JJ.
Right.
Did you know that those commercials are more like a lead generation kind of commercials, for the most part? Some of them are specific to a carrier, but what they tell you is it's kind of like, like if you buy a car and you looking for a car and you see a commercial that says, it has, all these extras, but a lot of times there's only 2 or 3 cars available. Mm-hmm. So the important thing is, do not believe everything that is on TV, because believe it or not,
or the internet.
Oh, the internet, yeah.
My mind is blown.
But don't believe everything that they say, because if you get really close and look at the fine line, it says some of these things that may not be available with all plans. Mm-hmm. So they talk about free and stuff. So just be aware of that. Also, The reason they should talk to me is because I have experience. I've been in the business, like I said, 25 years. I take all kinds of certifications and education, a lot of hours and all that. We do our best to show compassion, because every situation is different.
That's right.
We talk to folks that are going through a hard time, maybe some illness, some disease or something like that. And it's just try to understand their situation. And you're not a number to me, okay? We love doing business with our clients. And also we try to develop a relationship.
Sure.
We try to do our best to keep you informed through our newsletter. And then all our recommendations are based on personalization. Mm-hmm. I represent multiple carriers.
Sure.
And I'm not loyal to one carrier versus the other.
Right.
Right.
Right. Sure. Well, listen, folks, thanks for joining us today. This has been our first webinar. We were both a little nervous, so we appreciate your taking the time to be with us, put up with us, to laugh at a couple of corny jokes or roll your eyes or something at the corny jokes. And I've got one more question that's come in. I want to answer it, and we're about to run out of time. And by the way, one person in the chat said, "Go Packers." We're going to totally ignore that. If I lost my job in early 2021 and are not planning to work and join Medicare at 65 in July, does my premium have to still be based on 2019 earnings?
Yes, it does, unfortunately. Yes.
Okay.
Now, if you think that you'll be paying an IRMA extra amount, IRMA, you can always appeal it. There's forms that you can go and appeal it and tell them that you've gone through hardship situation. They will review it. They will review it. If you want to send me an email, and I can send you instructions on how to appeal that. It's hit or miss as far as that is concerned. One thing that before we go, I want to say thank you for your referrals. It does not hurt my feeling if you tell your friends about us.
Not at all.
Okay.
Not at all.
And
or your enemies. Tell your enemies about us.
Yeah. No. Don't tell your enemies.
Oh. Okay.
But one thing that my philosophy is always, I will never embarrass my whoever gets referred to me.
Right.
And number two is also I'm not going to be pushy. I don't peddle a product. I basically educate, provide information, and together we can make a decision of what plan is most appropriate for you. Mm-hmm. So, but
very good.
Any more questions? Thank you for the feedback that we have received, and we'd love to hear back from you. Let us know. We're going to try to do this more often.
We are. It's the first time out. We can do this again. alknowsmedicare.com.
Right.
Give us the phone number again.
404-256-2171. Also, our regular website is shopbenefits.com.
Shopbenefits.com.
Yeah.
But that doesn't roll off the tongue quite like alknowsmedicare.com.
And also go to YouTube channel, and it's
Al Knows Insurance.
Al Knows Insurance.
So it's been a lot of fun. Hope you've enjoyed it, and we're here to serve you and help meet your Medicare needs any way we can. No more questions. Thank you so much.
Thank you.
And God bless, and have a great day. We appreciate you so much.
Take care. Bye-bye.